It's gonna be good, it's gonna be great, it's gonna be better, I can't wait. Making my move, live for the day, sing like a bird, fly like a plane. Come spill with me, Jenny D.
Hello, my beautiful people. It's me, Jenny D from Spill With Me, Jenny D podcast. I am here at St. Clair Health, actually an outpatient in Peters Township. And thank you so much for St. Clair Health for being my sponsor and really tackling all these health issues that people are going through in our communities, in the surrounding areas. But here today, I'm so excited to have my guest here today. Well, it's actually June is National Migraine and Headache Awareness Month. So here with me today is Dr. Heather Moury of St. Clair Medical Group Neurology. Thank you for being here. I'm that excited to talk about headaches and migraines, but Dr. Moury, I just think that I know so many people that suffer from this.
Yeah.
So I really want to tackle this, and I hope this can help someone who's listening or viewing our podcast episode. Can you start by telling us about your background and what drew you to focus on treating headaches and migraines?
Sure. Well, thank you so much for having me. I'm excited to be here today.
And she's got her pink on. She's a Gemini.
I love it. I'm a neurologist and a headache specialist, and I think I started getting drawn to migraine as a kid, actually. So I'm a migrainer myself.
Oh,
and
really?
So I think it made a huge impact on me. So I remember as a kid ending up in the emergency room, actually. My mom couldn't get my migraine to go away. I couldn't keep my eyes open. Nothing over the counter was helping. And, she took me to the ER. It was so scary, to end up there. I think I was a teenager. And they gave me an IV. I have no idea what they gave me.
Right.
But I remember instantly, a wave came over me and I could see again. And I think it's so interesting. So during my neurologic, training, I've always been drawn to headache and the pathophys, but also just understanding that you can make patients feel better and get back to their normal life. So I think that's why.
Did it stop after you were?
Yeah, so actually the older I've gotten, the better it is. And I don't have horrible migraine or chronic migraine, but interestingly, as a kid too, I had Alice in Wonderland syndrome.
What? I've never heard of that.
Yeah, so it's a really interesting thing when you can see visual distortions of things. So I remember looking at my hand and it would be really big and then really small.
Gosh.
And it was so weird. I told my mom about it and she's like, oh yeah, that happened to me too. And it wasn't until I got to med school that I realized it was an actual disorder.
Oh my gosh.
Yeah.
And
so
on top of the migraines, you were seeing this.
Yeah, so it's a precursor to migraines. It often happens in younger children, but they can see visual distortions. It's almost like hallucinations, and you think you're going crazy, but it's really caused by migraine itself.
Oh my gosh, it's just top that on the list of
I know crazy things. Right.
So migraines are still misunderstood by many, and I know I'm not familiar. I do get headaches, and I remember sometimes I'd get a really bad headache, but I can't even imagine how people feel when they get that migraine consistently too.
Right.
What are some of the biggest myths what are the biggest myths or misconceptions about them?
So I think that a lot of people think that all migraines come with an aura. Actually, it's only around 30% that have an aura associated with it. And what an aura is you could see visual disturbances or have sensory like numbness or tingling, or even have difficulty speaking. And that can happen before a headache, but it's actually pretty rare. Only 30% of migraine patients actually experience it.
Oh, really?
So that's an interesting myth. Another misconception, I think, is that more medication is better. Oftentimes people are like, I have a migraine, so keep treating it with Tylenol, ibuprofen, or Excedrin, and you can actually do more harm to yourself.
You're kidding.
And cause more headaches. It's called rebound headaches, or it can lead to medication overuse headaches.
Oh my gosh, rebound headaches.
Rebound headaches.
Oh, wow.
So if you take Tylenol or ibuprofen more than 15 days per month, it can lead to like a daily headache.
What?
It can also happen with the triptans, so like typical Imitrex. A lot of people know that one in particular, just 9 days a month, or even Furacet. Which is an older med we try not to use because of its high rebound component. If you take it just 4 times a month, it can cause daily headaches. So,
oh, no.
Yeah, so sometimes too much medication, too much med is worse.
Wow, this is like valuable information, because I feel like, a lot of people don't know, and they think that they're just going to have to live with us migraines. And so what do you wish more people knew about migraine and headache disorders, especially during this awareness month?
I think that migraine is really misunderstood, and I would hope that as time goes on, we'll start to realize that it's an actual disease and it's not just a headache. So oftentimes people are like, oh, it's just a headache, get over it, right? But migraine is so much more than that. It can cause speech disturbances, visual disturbances, and if you're having these symptoms almost daily, it can be so irritating for a patient.
And I think that you're right. Like, if somebody doesn't have a migraine, they don't know.
And that's so hard. And so like other neurologic diseases, so if you have a stroke, you can see that deficit, that someone has weakness or they can't speak.
Right.
So it's easy for people to say, oh, well, they have that disease, I understand. But when you see a migraine patient, you can't tell that they're in pain per se, or that they're having symptoms. So, and I think that's why there's such a misconception around it.
That is so scary. I like how you said migraine is a disease.
Yeah.
And that I think, people don't take it seriously. Like, when you do run into somebody, oh, you just have it's just a headache. It's just more, it hurts more.
No, it really is.
You cannot say anything to someone unless you know how it feels.
Exactly.
So what's the difference between a typical headache, we were just talking about this, and something more serious like the migraine or the cluster headache? Sure. I've never heard a cluster headache. I was reading about this before I saw you.
Oh, yeah.
Yeah.
So I think we've all had a typical headache. Right. Yeah, so you don't eat enough, you don't drink enough, or you get a cold or sleep. Yeah. So, and that usually goes away easily. But migraines, you get more one-sided, severe, like throbbing pain. You can have sensitivity to light and sound. You can be nauseous. You can have vision changes, numbness, tingling, weakness, all of these things. But cluster headache is like a whole different bear. It's the actual most painful headache disorder.
Oh my gosh.
So it used to be, some people refer it to as the suicide headache, because people say that it's the worst pain ever, like worse than childbirth or getting stabbed is what people describe it as.
Wow.
And it's a typical severe pain, again one-sided, but then you also have autonomic features, so your eyes can get red or tear, and you can get congestion, and you end up pacing the halls because you just feel so restless and you can't find relief. It's horrible. It's so disabling, and it's so very different from migraine, which you want to be in a dark, quiet room. So they're very different disorders.
I didn't even know that. I mean, do you find that there are a lot of people that do get the cluster headaches?
That's a good question. It's super rare, actually.
Okay.
Yeah, I think it's like 1 in a million has a cluster. So, luckily, it's not so frequent. It's so horrible.
Gosh, I can't even imagine.
I know. The good thing, there's newer meds out there, luckily, that can help treat it and prevent it from being so severe. But yeah, it's still devastating.
I can't even imagine someone who has gone through that, or with the migraine or with the cluster, because way back when, I'm sure they didn't have the science or to know this person just is complaining a lot, or maybe there's, they're psychologically wrong with them, like because of their symptoms aren't the same as someone else.
Well, I think about that all the time, I mean, and think about how the psych wards used to be like so full many years ago. Like, what was that?
That is so true.
Was it a neurologic disorder? I mean, it's really, I think we've jumped leaps and bounds, thankfully, so there's not so many people that are in areas they shouldn't be.
And we're listening to people, we're listening to their symptoms, and knowing that, because you do feel like you're going crazy if nobody's listening to you, like, I've got this headache or migraine.
Absolutely.
But what are some of the common triggers for migraines, and how can patients begin to identify them? Like, that's the thing. How would I know if I'm having just a really severe headache or it's a migraine?
So I think that's an often people ask me that in clinic too. And it's hard to say. I think that every headache or every migraine is different. So, sometimes I ask patients to kind of define what their different type of headaches are. And then we kind of talk through and decide, is that are some of those symptoms migrainous? But that would be like the sun is bothering you, you're feeling queasy or nauseous, or you're having other debilitating symptoms with it, like difficulty seeing, or numbness or dizziness.
Right.
Yeah.
I mean, that's the scary part, because you don't know. Like, I remember I was dehydrated one time, and I was pregnant, and I had like the worst headache, and I was just like, oh my gosh, my head. Went to the hospital. Realized that it was because I was dehydrated.
Oh no. See, that's so scary.
So some of the symptoms are kind of the same.
They are. So it gets kind of confusing. And I think they go hand in hand. Like, some physicians define them very separately, like headache, tension headache, and like migraine separate. But in my mind, it's kind of, you have both, and it's not uncommon to have headache and migraine, and just kind of differentiate between the two. And then when we're treating our headaches too, we kind of decide what's the best med for that particular headache. Like, we have geared migraine specific meds that would maybe help the migraines better and maybe not the headaches as much. But sometimes the migraines medicines work for headache too. So it's interesting.
And it's probably individual based. Like, it depends. This person, it may work for this person.
Absolutely.
I always wonder because, sometimes you get that headache and it's like across your forehead where you're like, and you're, right next to your eyes, like your temples, and you're like, oh my gosh, I can. And
that is more of a tension headache. So you did a good description of it. So it's like a band around your head, and that's So, and those I think are more commonly associated with stress too. And we've probably all have gotten those. But but I mean, other triggers can be. I mean, it can be stress. Number one, I think it's like 70% of us get stress triggered migraines, unfortunately. Not sleeping enough, which is so hard, because I know a lot of people have hard lives to get that regular schedule, but the brain likes consistency. So, sleeping the same amount each day, maybe on the weekends not sleeping in, that can actually make patients worse. Well, you said some of the other things, staying hydrated, eating a healthy diet, but triggers can be foods though too, like alcohol, caffeine. MSG, cured meats.
Oh my god!
I mean, the list goes on and on. But I always say to patients, though, be careful with triggers. We don't want you to be so concerned about everything as a possible trigger, because then you're afraid to
do anything.
You're afraid to do anything.
You can't go to a restaurant. You don't want to go to like a family function.
Right.
Like, what if they don't have the things they need to eat?
Right. So I always say, if you want to do a diary or a calendar, and if you find that, okay, every time I drink a glass of wine, that's triggering me, then maybe you want to avoid it.
I usually wake up with a headache.
Do you? After wine, yeah, absolutely.
They always say, like, if you do drink alcohol, that you should drink water too.
Yeah, to stay hydrated.
Each time you would have that, because it does. You wake up like, you think it's either you feel like you have a hangover, or it's just this headache of like, like we said, you're dehydrated. Or,
So it can be the wine itself, but then also the dehydration. And there's always been a misconception about chocolate too.
Yes.
So people always say, oh, don't eat chocolate, it'll give you a migraine. Well, there's been a lot of studies about this.
My sister-in-law, that's
really,
years ago, she told me that. I was like, what do you mean by chocolate?
Well, so technically it can, but the studies also show that you might crave chocolate when you're getting a migraine, and that might be what's causing the headache, actually, the migraine. It's the craving, not actually the chocolate. So if don't not eat chocolate. Yeah. Enjoy your chocolate, unless you know that it's always causing a migraine each time.
Don't take away the chocolate.
Don't take away the chocolate.
We live in Pittsburgh. We
need it. We need it.
It helps with stress. So how does living with chronic headaches or migraines affect somebody's quality of life? I mean,
yeah, that's a big one.
Can you work? Can you exercise? Can you do anything?
I know, it's so disabling. I mean, imagine waking up every day with some sort of pain. And it's devastating, I'm sure, to have chronic daily headaches and then to have migraine on top of that, which is so disabling. I think it affects your family, it affects your education, it affects your career, your social activities, I mean, everything. If you had visual disturbances, try driving to work. I mean, patients often say, well, I can't drive when I have a migraine.
Yeah.
Or if you're having speech disturbances, I mean, trying to run a meeting at work, you wouldn't be able to function.
Everybody's looking at you like they don't understand that you're having this migraine or this really bad headache.
Right. So it's so disabling. And I think that's where it's important to know that there's this community for migraine too, that we understand that you're going through that, and there are resources to help you, support groups and the things, so that you don't feel alone and you feel heard, because it is disabling. Absolutely.
Yeah, because if you, anything you do, I was reading about Amy's story.
Yeah.
And it was saying that, she couldn't be a part of her family's life. She was missing out on so many things.
Yeah.
And to hear that, she tried some things, but then she did find something to really help her.
I know, yeah. And unfortunately, sometimes that's what it takes. It takes so many things that you have to try, meds, device, there's neuromodulatory devices out there, there's procedures, nerve blocks, Botox. I mean, there's so many things to try nowadays, which is good, but sometimes it takes you a very long time to get to a manageable place.
Right, yes, I do hear a lot about Botox.
Yeah.
What do you think about that?
I think it's very helpful.
What does it do to help with the migraines or headaches?
So it gets into those muscles, in my mind, is how I think of it, and kind of calms down that tension. Technically, it's getting into the nerves itself and going into that migraine generator, which we think is the trigeminal neurovascular complex. And by getting in there, it's lessening that pain. But you have to think about it too. You're putting it in the muscles around your head. It's quieting down those muscles.
Oh, yeah.
So they figured out Botox worked, actually. Do you know how it came about?
No.
When patients were getting it for cosmetic reasons, they realized their migraines were getting better. And that's why they started studying it.
Oh my gosh.
So, and that's why we put them around the eyes and then the temples.
I get it done on my forehead. Yeah. And it's been about 2 years that I get it done. Yeah. And I mean, at first you get a headache. When you first get it done.
Yeah.
But then it goes away and you're fine. But it's, I didn't even think about that.
Yeah. So you might be treating some of the migraine itself too.
Right. Yeah. I might. Yeah. I know that, growing up, I'd have headaches during certain times, but I don't even know if this question's on here, but what do you do about menopause? There's a lot, some women, first of all, my sister-in-law suffers from migraines.
Yeah.
I think it's a little bit better now. It's not as bad, but she said since she gets migraines that she is with menopause, she's perimenopause, she's not able to get the hormone replacement therapy. I don't know if you know anything about that.
Yeah. Well, I mean, it's a loaded topic.
Yeah, that's a whole nother topic. Okay?
But I mean, I think hormones are very important for migraine. That's another trigger. Oftentimes patients note that around their menstrual cycle is when it first starts, right? So changes in the estrogen and the progesterone can cause migraine itself. Then we know when patients get pregnant, often the migraines do get better, but sometimes patients get worse. Right. And then in menopause, it's the same thing. So those hormones are shifting again. And most of the time people kind of go through a spurt that they can get a little bit worse with the hormone changes, but then eventually they get better.
Right.
So, and then to your question about like hormone replacement. So we always get worried when patients have a history of aura with migraine, because that increases your risk of stroke. So I always say
get evaluated.
Get evaluated. If you have a history of migraine, or especially aura, you shouldn't be on some of those hormone replacements, because that can increase your risk for stroke.
Yeah. So definitely consult your doctor.
Yes.
But because I was, when I was, I do this Menopause Monday series now because of course I'm in it. So okay, we're going to talk about it. But I remember getting so many headaches in my 40s, and I would just be like, here and there. And I didn't know what that was causing, because I'm like, why am I getting, and I thought it was just stress. So you're right, like your hormones, the lack of things that, there's just so many factors that can happen.
Yeah, there are. And I mean, you can talk to your OB too. Sometimes they can give you different hormone replacements that can help with that. But it's definitely that transition that makes it worse.
Options, and that's what I love about that nowadays, Does lifestyle management play a role in treating or preventing severe headaches?
Absolutely. I think we've touched on that a little bit already, but I always tell patients that, you have to meet me halfway. So I think half of it is meds, but half of it or more is lifestyle, right? So what you're eating, what you're drinking, how you're sleeping, getting your exercise your stress relief, all of these things play such a huge
so there are factors in your lifestyle.
Absolutely.
So if you change some of the little things,
it might
this
help.
may help a little bit. I'm sure if there's somebody out there listening and they get migraines, just changing a couple things may help something.
Absolutely.
On top of maybe taking some meds.
Absolutely.
What's so, what you said about science, and here being in Pittsburgh and having St. Clair Health here, we have so many professionals and experts that can really help you through these things. I can't even imagine, but how do you customize treatment plans to help patients regain control of their daily lives? How would you do that?
So I think that every person is different. Every headache is different. So, it's taking into that consideration. What's their past medical history? Do they have a history of insomnia? Is there maybe a med that we could use that could help with migraine and sleeping? And then, what are you doing for your daily life? Are you on the computer all the time? Do we need to talk about blue screens? Or do you have young kids and we don't want to put you on meds that could be sedating? So I think it's taking that whole picture to try to find the best treatment plan for patients. And obviously we want the less side effects that we can get, but sometimes it's not always possible. But
that it would be great to just take something and then go to sleep and wake up and not have a migraine.
I know. Absolutely.
But I love that you're, Dr. Moury, I love that you're saying that everybody's different, so you are going to customize that plan for that patient.
Absolutely. That's why I like to get to know everybody, know all about them. And I'm a DO, so I always was trained it's body, mind, and soul. We're taking all of that into consideration. And maybe a patient doesn't want to be on meds. Maybe they want to try more
holistic ways.
Holistic ways, and that's okay. We'll talk about what other options there are.
And that's what I love about that, because you're not pushing things on. Nowadays I think that we, in the healthcare, we are looking at every little aspect instead of just writing a script, And I love that, you're here and you specialize in migraines and headaches. Disorders, would you call them disorders?
Absolutely. I think it was, I actually started my career and a lot of people told me not to go into headache medicine. Isn't that so interesting? Because they're like, you could do something more interesting in neurology. And I was kind of offended. I'm I like this. So I actually experienced it. Firsthand. So they talked me out of, I actually did a neurophysiology fellowship. And then I was like, wait a second, I like this, but I still like headaches. So then I went back and did more training for headache medicine.
I did see that. Were you your background, were you Kentucky, or you got your, and then you did your internship here?
So yeah, I actually grew up in Denver, Colorado. Well, I was born there. My dad was in the Air Force, so we bounced around a little bit, but I was really raised in Pittsburgh.
Oh, good. You don't have the Pittsburgh E.
I really don't. Yeah, I don't. And then, I went to Pitt for undergrad, and I went to med school in Kentucky. I fell in love with that school. The dean was so wonderful, so I traveled down south.
Yes.
I do have a twang sometimes that you'll hear. But then I came back home where my family is, too, and I trained at Allegheny General Hospital.
Oh, that's wonderful.
Yeah.
We're glad to have you. That's for sure. And my gosh, there's people out there like, I'm going to call you. For those who push through or like self-treat the pain, at what point should they consider seeing a specialist like you?
Well, I think, if you're taking medication more than just a couple times per week, or that medication isn't working and you're not getting a relief, that's when you really need to consider seeing a specialist to talk about your other options.
Right.
It's okay to take an occasional over-the-counter med and it makes your headache go away or your migraine. That's fine. But when it starts to be debilitating and affecting like your job and whatnot, that's when you should come see us.
And like you said, if you're taking it every day, I don't know if it becomes like it's not as working as much. You know how when they say if you take an antibiotic or take something so much that it sometimes doesn't work as well.
Yeah, that's how I kind of think of it too. I mean, it's building up in your system. It's there all the time. And then your body's like, what am I supposed to do with this? So it doesn't work anymore.
So migraines, this might be a stupid question.
No, there's no stupid question.
My mom uses that. But no, can it be hereditary at all?
Absolutely.
Oh, okay.
Yeah, absolutely. I mean, that's like a big question we always ask in clinic too. Okay. So who has migraine in your family? I mean, almost always it's someone in your family has it. It can be sporadic, but often we don't know all of the genetics behind it, but there are some types of headaches, like in particular hemiplegic migraine, where you can get like actual weakness on one side of the body.
Oh my gosh.
It's a big genetic disorder.
Wow. That would feel like you were having a stroke.
Yeah, it does. And then they end up in the hospital and getting worked up for stroke all the time. And it's so scary. They can get the stroke medication, like the clot busting drug. Sometimes. But it absolutely is hereditary.
Okay, because I was like, I'm wondering if you have people in your family that have suffered from it. So, and I'm thinking, well, maybe that could be something.
Absolutely.
You know, with your expertise, is there something in your brain that triggers it, like it just gets this migraine, or is it just could be anything?
I think that's a good question. Oftentimes, everyone's looking for that answer, what's wrong with me? Why do I have migraine? And oftentimes, there's nothing wrong with you. You have the disease. So that's where I come back to thinking, okay, this is actually a disease. Yeah. So number one, it's genetic. So we try to pull that out, tease it out, where in your family. But our job as providers too is to really look for the secondary causes of headache disorders. Mm-hmm. And most of the time, migraine, we're not going to find it. Like, we're not going to find an abnormality on your brain MRI. If we do blood work, if we do lumbar punctures, most of the time we're not going to find anything. So it's our job to kind of discern, do we need to keep doing more workups, like look for aneurysms or whatnot, or is this a typical migraine?
Right. Yeah. And that was the other thing too. I was thinking about that. My mother-in-law had an aneurysm years ago.
Oh yeah.
And she said it was like the worst headache ever.
Oh my goodness.
Now she did go to Jefferson, and they did operate and everything on her.
Goodness.
But she said it was like the most horrible headache.
Yeah, so we call it the secondary type of headaches. So something is causing your headaches, and so if you have the worst headache of your life, you need to go to the emergency room
right away,
because that could be it's called like a thunderclap headache, a quick onset worst headache of your life.
Right.
And that could be something that you need a surgical attention for, like an aneurysm, or could be bleeding in the brain, or scary things.
That's the scariest thing. Like, you don't know, like, what's the difference between just having this really bad migraine or having this, that just comes on though. Like all of a sudden it's like, oh my God, it's.
Well, right. Yeah, absolutely. So I think, the American Headache Society actually doesn't recommend that we take an MRI of all migraine patients, because the majority of the migraine patients that we do image are absolutely normal. But if people have secondary things that are abnormal, like different symptoms that don't make sense with migraine, that's where we have to consider, what else could this be?
Right. Yeah. Let's really,
dig
look
deep.
into it. Dig deep. Yes. Dig deep.
Yeah.
Is there any final thoughts or takeaways you hope your listeners remember during National Migraine and Headache Awareness Month?
I think that it's just understanding that migraine is just so common, and unfortunately it's still very misunderstood out there. There are a lot of groups out there that are trying to raise migraine awareness, like Shades for Migraine. That was just June 21st.
Okay.
Our neurology group did wear our shades, our purple shades, and we posted online to raise awareness. So I think that's wonderful to do. And we are actually hosting with Miles for Migraine a walk. It's October 4th at 9:30 a.m. in the Rolling Hills Park. So in McMurray. So we would love for you guys to join us.
Yes. I live right down the street.
Oh, do you really?
Yes.
Oh, so join us. So we have a page. If you just Google Miles for Migraine Pittsburgh 2025, you should be able to find us. And you can start your own team. And we're hoping to grow this each year.
Is this the first time you're doing this?
It's the second year. This year we're going to have some sponsors too, and some, tables out there. So I think it'll be a great event for patients and to meet others and know it's a community.
Yes, it is. I mean, it takes a community. I always say it takes a village to really help each other, and just to have the awareness if somebody is suffering, to know that, help them out or recommend, coming to St. Clair. And, that would be my biggest thing too, is that, I was not aware of how severe when somebody would tell me they have a migraine, they get migraines often. It's like, wait, I mean, how bad is it? And
I know.
I mean, just the symptoms and the things that you mentioned, I'm like, no.
I know. It can be so severe. I know. Sometimes you see when they walk into my office and they just look horrible, you're like, oh my goodness, you feel so bad.
Yes.
And sometimes you can't do too much that day.
Right.
But other days you can make a big difference. That's always rewarding for me too.
When they walk away
and feel better. Yeah, then you feel like you're helping.
You're like an angel.
It makes you feel good for sure.
One more question, hon.
Yeah.
Would you say that more women get migraines, or is it like half and half, or more men?
That's a good question. It's definitely more women. It's like 3 to 1. Yeah. So, and I think it absolutely has to do with the hormone changes too. That makes the big difference. But we can't ignore men. Men get it too. So it's real, and cluster headaches.
Sometimes they probably don't come in. They don't realize.
They don't. Yeah. And I think they probably have even more stigma around them, and trying to seek medical attention. But definitely out there. And cluster, they used to think that it was it's more common in men, but it's starting to come out that it might be more common, more equal than they thought in the past.
Really?
Yeah. So interesting. They're
Listen
always
to
studying.
your body.
Yeah, listen to your body. Get checked out.
This is what I always say. Don't suffer in silence, and don't live with something that you could go and have checked.
Absolutely.
There's so many professionals out there that can really help you.
Absolutely. Yeah.
I thank you so much.
Thank
this was such good information. I feel like I've learned so much, Dr.
Good.
Moury, and I just appreciate your time today.
No problem. Thanks for having me.
So great. So if your headache pain disrupts your day, you're not alone. For those experiencing frequent or prolonged headaches with intense pain and conventional remedies are proving ineffective, like we were talking about, it might be worthwhile to consult with a headache specialist like Dr. Moury. Call 412-942-6300 to make an appointment. She sees patients at offices locations in Waterdam Plaza and Mount Lebanon. So don't fret or don't think that you're wasting someone's time. I think that's the other thing, the misconceptions of people are like, oh, it's just a headache, it'll go away. No, go get checked, get evaluated.
Get checked.
Yes, I mean, come on. We have one life to live.
Enjoy it while you can.
Exactly. So thank you again for being on Spill with me, Jenny D. And thank you, St. Clair Health, for being my sponsor and really bringing awareness for so many different diseases. Now we're saying migraine is a disease. So thank you for joining us with another episode. Take care.
Come spill with me.